I guess my first topic will be right after I stop the other video, but I have been living with BPD my whole life, and I like to call it BPD BSM, which stands for BPD before social media. I want to say, struggle with BPD, but you learn to live with it. Not everything's a struggle. And I say that before social media because I know it's pretty popular and trendy to self-diagnose. And I feel like BPD is one of these very trendy diagnoses, which I don't know why anybody would want this, but I wouldn't wish this on anybody. But I've had it diagnosed since I was like 14 when I went to my first program. That's the first time I even heard the term. And at that time, it was like, oh, you're bipolar, BPD is like a taboo thing. No one even knows what it means. But yeah, it's something that I deal with every single day, and it's something that you learn to deal with. I don't take meds. I don't go to therapy anymore. I've been under every single cocktail under the sun, and what I could say from personal advice is these doctors and therapists and whoever that prescribe these things have never taken them. They've never taken them, and they'll never take them, so they have no idea of the side effects and what it actually does to your body and to your mental health as a whole. So I've taken, Seroquel, lithium, some of the Abilify, Risperidone, all of them. All the depression ones, several antipsychotics, obviously the Xanax, lorazepam, what is this one called? Adderall. People just like whatever they're fed that day is what they're prescribing their patients. So I'm a big person for specific mental health issues, medicines don't work, and that's just me. And that's because I've been going to therapy since I was 7. So I'm like a therapy and mental health vet. I do consider myself that because it's been, my whole life basically that I've been in therapy. My mom, when I was little, she would call it the talking lady. So, I feel like I'm really well versed in mental health, and I feel like I can give this advice because I've been dealing with it my whole life. But for me, what's worked out the best is obviously stress. And now that I have been without work for about a month and a half, I see how my body reacts, and stress is the main factor for BPD splitting and going into a psychosis or episodes. My episodes were pretty frequent, and with age they've gotten better, but definitely when I was younger they were very violent. I've hurt a lot of people, physically, mentally, emotionally, and it's something that I have to live with. Not very proud of it, but this is obviously out of my control, or more so not that I could control or I didn't understand at this time. So it's just something that you just learn to cope with and live with. And anytime I see somebody that I have hurt, I try to take the opportunity to apologize and remind them that it was never about them. Yeah, so the video cut off. I guess my phone locked. But anyway, what I was saying is that anytime that I've gotten the opportunity to speak or see some of these people that I've hurt, in my lifetime, I definitely try to apologize and let them know that it was never about them. One of the things that I have to live with having something like this is extreme guilt. So for me, it's like, you get really, really, really high up with this aggression and pure rage that you could just conquer the world. You're like Godzilla, basically. Like anything in your path can be destroyed. And then because I'm obviously a very kind of emotional person, I personally get hit with extreme guilt after. So they're really, really, really high highs and then shoot down to really, really, really low lows. So obviously that's the worst part about it, is after you're high up and nothing can touch you, then you get hit with extreme guilt, worrying, anxiety, things like that. But one of the things that I personally, when I'm able to, is apologize to the people that I've hurt, and let them know that it's not about them. Because what happens is when you vomit your pain on everybody, they have these subconscious things of, oh, it's my fault, or something is wrong with me, and this and that. So it's never really about them. It's more so about me and how I was triggered. Obviously people trigger you, or they trigger me, and not everybody is well versed in how to handle someone with this type of diagnosis. They're just shown to or learn, they know how to defend themselves. So obviously people will defend themselves however they can, and some people express hurt in different ways. They'll try to hurt you back or hurt you worse, or go back and forth and try to one up you and whatever. People don't see that this is an actual sickness, and that's the worst part about it. And I used to make this statement all the time, like, someone that's in a wheelchair, you wouldn't roll them into oncoming traffic, right? Anyone in their right mind, I guess. You obviously see that they have a disability, they can't use their legs, they can't walk out of there, right? They have to like roll themselves out. Same thing with someone that has a very severe mental health diagnosis. You don't want to trigger them on purpose. Some people have that thing where if they're mad or if they're sad, they want everybody around them to be mad or sad, and they trigger people on purpose. So for me, I always use that thing so people have a visual, like, okay, just because you can't see it doesn't mean that it's not there. So that's always been a big thing for me. You know, obviously I've had to deal with this my whole life, and my family is not, like, this is not something that we've had an open conversation about. I've never said my diagnosis is this, like, this is what I've been diagnosed with from several doctors. Like, this is not something that I'm making up. This is not something that whatever. And obviously if anyone does their research, you know, if you put two and two together, all the traumatic experiences that I've had as an individual would lead up to this, right? Apart from the fact that genetically my family has had, you know, several I think, right? They never say yes, but other mental health issues. But, you know, I'm happy to answer any questions. I would love to be able to mentor some younger people, you know, because I know this is something that people deal with every day, and it's obviously a more common diagnosis, you know, these days. But I would love to be able to help anybody and answer any questions, you know, whatever I can do to support people. But yeah, like, my thing is just always been just taking it one day at a time. The gym helps a lot. I recently started the gym again, but the gym definitely helps. Having a person, your favorite person, you know, your partner, a parent, a family member, a good friend, someone that understands what you're going through to help you navigate the episodes and splitting, because those things are real, you know. The disassociation is real. Like, I've actually seen people online like, oh wait, watch me disassociate. It doesn't work like that. Like, you can't just say, oh, 1, 2, 3, go. It does not work like that. Anyone that does it does not have this issue. And like, it's actually like kind of hurtful. It's like, bro, like, why do you want to be this way? Like, why are you pretending to be this way? You don't have this issue. You cannot make yourself disassociate. Like, I don't care what anybody says at all. It does not work that way. You, like, someone that is actually going through like a splitting or an episode or a moment will not fucking record themselves. And if you do, maybe it's like a Gen Z thing or a younger person. I don't know. I would never pick up the phone and record that shit, because literally, like I can't. I could not. And that's just my own personal thing. Some people may be like, oh, you know, that's not everybody's the same or whatever. I don't know. I know a lot of people with the same diagnosis. Like I said, I've been in a lot of places. You know, Baker acted through 3 different counties, like full Baker acts, minimum 72 hours. Baker Act in Florida is a doctor putting you on a hold in a psychotic hospital or whatever they're called, the mental hospital. Minimum 72 hours, because they deem you a danger to yourself or to other people. And I've always completed my 3 days. Sometimes I was held a week and a half, whatever. But I've been a lot of places. And like I mentioned previously, my program, I was in Jamaica, Zero Tolerance WASP program for 15 months. I've been in a lot of places. I've been around a lot of people. I know what I know because I've been doing this for a long time. Like I'm saying, 7 years old, going to therapy, like, that's just not how it works. You can tell when somebody's faking something. You know what I'm saying? And you can also tell when somebody has something going on. Like, there's always something in the eyes. So I've seen it so much and I've been around it so much that I know what it looks like. Even people that hold themselves together real well, buttoned up, you know what I'm saying? That you can always tell there's just a little something in the eyes that gives it away. But I'm not trying to take away from anybody else's experiences. I'm just saying that I've been at this for a really long fucking time. I know what it is, and I know what it's not. So there's one thing to have a mental health issue. There's another thing to be a fucking brat. Honestly, I'm so sorry, but you know, not get your way, kick and scream, all that stuff, you know. But there are people that have very severe mental health issues, and those are the people that I'm trying to reach. It would really actually help me with my own stuff to be able to help somebody else, you know. I do feel like BPD is something that happens to you, right? But I do feel like there's also some type of genetic thing that's there that has to be activated, because I see it in myself. I see it in my brothers, you know, because I have we're almost twins basically, but we're 2 years apart, and then I have 3 half brothers, which I all love very, very, very much. We all grew up together. Well, me and my brother were older, but you know, I see it in them also, so I know it's somewhat genetic, you know. And I feel like opening up the conversation, making it less taboo, making less of it a trend, like making it less of a trend is good. And if I can reach one person out there, you know, then that's it. My job is done. But you know, we're all like, no one's perfect. We're all trying to figure it out. You know what I'm saying? So yeah.